42-year-old woman begins exhibiting fever and chills 1 week after returning from a missionary trip to Sudan. Her pulse and blood pressure are normal. A painful rash has developed on her body, and there is no sign of its reprieve. American doctors are perplexed about the nature and cause of this woman's ailment. This is a standard case of Ebola hemorrhagic fever, but due to the lack of educational exposure in the U.S., the American doctors are unsure of exactly which tropical disease. As the mystery progresses, atypical lymphocytes are detected. Within the second week, the woman is dead due to the lack of antibody response. There is no cure, and the only treatment doctors were able to administer consists of maintaining her vital signs and bodily fluids. A postmortem autopsy was performed immediately following her death. The result of the postmortem's report is in. The patient was infected with the Ebola virus, a deadly tropical virus. So I'm going to be talking to you all about the Ebola virus and just becoming aware of this endemic disease that plagues Africa and Asia today. So the Ebola virus, also called Ebola, causes viral hemorrhagic fever in humans and non-human primates. It's endemic to Africa, meaning that it's specific to Africa, but it can travel to other places. It was first identified by Dr. Ngozi Mushula in Zaire in 1796. He was the first one to actually see it and see its structure and name it under a microscope. It belongs to the order of Monogaviridae, family Filoviridae, and genus Ebola virus. There is a similar bacteria to the Ebola virus, which is called Marburg, and it causes some of the similar symptoms. It actually looks like the same shape, but it is different. So now I'm going to go to some demographics. The first emergence of the Ebola virus is in a polio vaccine plant. They actually had some Ebola viruses, and one of the workers was infected, who passed away. And with autopsy on her, they found the Ebola virus in her system. There are actually 13 strains of the hemorrhagic fever virus, and most of the names are based on like the demographics of where the actual country it is found, such as Zaire, Sudan, Ivory Coast, Reston. They don't actually know the natural reservoir of the virus, but they like to think that it lives in fruit bats. So it's a zootonic virus because they think, we're not exactly sure right now where it naturally resides, but we think it's gorillas, primates, and fruit bats. So people who normally get the Ebola fever virus, most people who get the virus are actually part of the Africans, because can be part of their diet, and since it seems to be residing in primates when they actually eat that meat, part of rituals or just part of their culture, that they end up getting the virus because it's part of their culture. So local physicians are also have appeared to be a lot more helpful in trying to combat Ebola, because they've seen it more, because we haven't seen it that much in the U.S. because it is endemic or specific to Africa. So some of the symptoms of Ebola virus, you can have the capillary leak, which causes like swelling, and you can cause shock, and you can have coagulation defects. So actually, when your immune system tries to do a response in response to the virus being present. It also can cause fever, chills, malaise, which is just basically a general feeling of unwellness. It can cause severe headache, pain, prostration, stupor, hypertension, bruising. But the most common telltale sign of Ebola hemorrhagic fever is a maculopapular rash that appears on different areas of your body. So the incubation is about like a couple weeks up to about like a month, so 2 to 21 days. And since the hemorrhagic fever looks so much like other tropical diseases that are present in this area, that the only sure way to know that you have the fever is to do a diagnostic test. And presence of certain antibiotics such as immunoglobulins M or G can be, if they're found in your immune system components, that's one of the ways to tell that you have the fever. So some of the ways it's transmitted is obviously person to person. So like coughing and inhaling water droplets, that's how you can get it. It's not really necessarily will stay in the air because it's thought that the UV components from the sun will actually kill it. In labs, they found that it can be transmitted very well in the aerolized version. So like if you have it in an aerosol can, and if you spray it on something else, like they found that spread really well. And some different things that can actually kill it is gamma radiation, formaldehyde, beta prolactase, and some phenol disinfectants. But these are some of the only things that they found can actually kill it.
6 minutes.
So treatment, lastly, I'm going to do some treatment and cures. There are no cures for this violent fever. The most things that it can do is just help your vital signs, make sure your blood pressure stays steady, your heart rate, and make sure that you're not dehydrated. Basically, they do more of a prevention method, so just trying to keep things sanitary, but which is harder when it's in poor countries in Africa. They're working on a possible vaccine, which of course would just use the attenuated virus and to try to get your body to produce memory cells to actually kill it. But the problem with that is actually infecting someone with this, even the attenuated virus can put possibility of putting them in danger to contract it and actually die from it. And since it is such a violent disease and there's no cure from it, that's kind of ethical problems that they've had to deal with. So also they've had, since there's so many strains, and they've found that it adapts so quickly that it's hard to find a vaccine that is like widespread, not like the smallpox or the cowpox virus, but one that can work for every single case. And